Have you ever wondered why so many women are told pain and stiffness are just a part of getting older? Are you tired of managing symptoms but never actually feeling like your body is improving? Well, what if I told you that decline is not inevitable and your body is actually capable of rebuilding strength, mobility, and resilience, even with autoimmune challenges? If that sounds like something you are struggling with, you're not alone. So many of us struggle with feeling trapped between flares, fear of movement, and the belief that our best years are behind us. Welcome back to the Health Bridge podcast. I'm your host, Holly B, and I help women with autoimmune conditions reduce flares, restore energy, and rebuild trust with their bodies again. Today, I'm joined by Eileen Kopsaftis, a physical therapist and movement specialist who has spent decades helping people eliminate pain and age without decline. We're diving into how hidden movement patterns, inflammation, and mindset shape the way we experience aging, as well as pain and inflammation with autoimmune conditions, and what women can do to retrain their bodies, move safely without fear, and step out of pure symptom management and into true healing. By the end of this episode, you'll know how to start moving your body in a way that supports healing instead of triggering fear, and why pain is not something you have to accept as your future. So stick around because we're answering the question, is it really possible to age without decline, even with autoimmune diseases? Eileen, I'm so happy to have you here to have a really good discussion on pain, inflammation, mobility for our women with autoimmune conditions. I know that's not your specific specialty, but you've worked with many people that do have autoimmune conditions and so can speak to different lifestyle management, different things that we can shift to help accommodate or even potentially get rid of or minimize the pain. There's something that I've noticed with women with autoimmune disease coming from the Western mindset. They've basically been told pain is normal, inflammation is normal with fill in the blank disease. This is just something that you're going to have to live with. We can manage it with pills, injections, whatever. Something from a prescription, right?
Yeah.
And while those things can be helpful for sure, and I'm not saying that we shouldn't go that route, I think that there's two things that I see. One is it normalizes the expectation of pain. And I think there's some danger in that. And I guess I'd like to just start there, actually. Why do you think we normalize pain? And do you see danger in that as well?
Yes, absolutely. As a matter of fact, I just did an online event yesterday on stopping joint pain, and I talked about that very issue. The medical model is about addressing symptoms. And, I've been in my profession for over 30 years, and I've seen pain is something that the healthcare world really knows next to nothing about and really is very ineffective at addressing it. And I think when someone, and this is not me disrespecting medical professionals, but when a medical expert feels like they don't know what to do, or they don't have a strategy that they know is going to work, they feel sort of, I'm kind of putting this on them, but I think they feel a little incompetent and they don't like that feeling. And so they'll say, well, let's try this, let's try that, let's do this, let's do that. And they really don't have a lot of confidence in what they're even suggesting or recommending. And I've seen this for a lot. And a lot of people come to me with pain, and they were told that they were led to believe that it was kind of in their head because no imaging, no test, no anything that was done objectively showed the reason for the pain. And so pain people are so unique. No matter what's going on in their world, however many diagnoses they have, if 3 people came into a clinic setting and they had the same diagnosis and the same symptoms, all 3 people might require a completely different strategy and plan of care to resolve their pain because we're all so unique. We have different personalities, different lifestyles, different history of nutrition, different activity levels, different histories of accidents or surgeries or whatever. So the reason one person has pain, even if their symptoms are similar, might be very different than the person next to them. And I think there's this thing now with evidence-based medicine. And I find that really inaccurate when it comes to pain, because there's no way that you can have this protocol for a specific symptom that's going to help people. And I'll give just a little example so people can understand what I'm saying. Say somebody walks in with knee pain, and there's an imaging that says, oh, you've got arthritis, it's moderate, this is why you have pain. Well, when I assess them and I look at them and I look at their movement, I realize, your hip isn't externally rotating. So every time you go to take a step or you do something that requires rotation, your knee is getting yanked, it's getting punched, and it's not happy. But there's nothing wrong with your knee. I don't care what the imaging says, it's your hip. And so we'll address the hip issue, and before you know it, they don't have knee pain anymore. Now, I didn't wave a magic wand over the arthritis. So there's so much misunderstanding, and I will just bluntly say lack of understanding of how everything's connected in the human body, how it's designed to function from the time you land on your heel to push off your toe when you're taking a step. Very few professionals have that knowledge. And so they're going to be limited in how they can help people because they're going to see them as a body part, or they're going to see them as a diagnosis. Oh, you have AI. So, you have this autoimmune issue. So obviously, you're going to have pain. What do you expect? And it may have nothing to do with their AI issue. It may have everything to do with the fact that they've got some biomechanics that have gone awry for whatever reasons. They fell off a bike when they were 12 and their body's been compensating for 10 years. And now those compensatory mechanisms have decided, you know what, I give up. I'm not designed to do this. The guy below is supposed to be doing his job and he's not, but yet it's blamed on AI. So I think we really have to be careful with these just blanket general statements that, well, you're supposed to feel this because of that.
You are so capturing what I see and feel all the time, especially with autoimmune conditions. Again, women are always told, like, oh, these are all symptoms of your autoimmune disease. Yeah, but have we considered your lifestyle? Have we considered the stress you're under? Are you getting sunlight every day? Are you hydrating with clean water? There's so many other factors in whether or not that pain presents. Nothing is ever just from a disease, in my opinion. And also, I work for a chiropractor during the day, and I see this all the time. People are coming in because they're trying to not have surgery that was recommended to them. And the doctor does an assessment. It's like, no, like, we can work on this. Surgery is not your only option. It's exactly like you said. Yes, I feel pain in my knee, but there's a whole string of events for that pain to get to the knee, unless there was some literal acute knee injury that we're talking about. I understand too that many things come from the pelvis and the hip alignment. So if we can adjust that area, oftentimes it's sort of like a domino effect. Everything else can fall into line. Doing chiropractic work alongside of physical therapy is often, I think, a magic combination when it comes to physical pain and joint pain. And I don't understand, and this is why I do this podcast. I don't understand why this information isn't more commonly known. But if you were born into and come from strictly the Western mindset, that is all you know. And so I'm doing my very best, and I know you are too, to crack open that door of understanding that, oh, there are actually other things out here for us.
Yes, it is one of the reasons I do so many free online events. And as you're aware, free events on our end aren't free for us to host them. And I got my YouTube channel, I've written my books. This information is not mainstream knowledge, but it needs to be. And I came across some information recently that someone shared in an email, And I'm familiar with, the neural pathways and how the brain works. And it is plastic. We have learned that things can change. It's not like your brain doesn't grow or doesn't improve as you get older. And it was interesting, the perspective that I hadn't thought of. When we grow up, our brain is learning from everything around us, the environment, and it does create these kind of ruts of belief. And so if we grow up around people who believe, oh, well, you're supposed to be in pain as you get older. You're supposed to have this. You're supposed to have that. Everybody gets sick. Everybody's on medication by the time they're 50. And when you see this as truth, and then you get presented with a different perspective, your brain initially is going to have this knee-jerk reaction of, I can't accept that. That's not true. It takes a while. You've got to kind of keep hearing it in order to start to accept that there may be another perspective that is valid. And it's alternate from what I've believed all these years. And I can tell you that most of the time in my events, the response that people put in the chat or say online is, it makes such sense. When they hear it, it makes such sense. So when you explain how the human body is designed to move mechanically, the joints and how everything's connected, yes, the hip is really powerful, but so is the ankle. I assess the ankle function of every single person that I work with, and I teach a lot about ankle function in everything I do, because of the fact that if that ankle's not performing correctly, it influences all the way up to the neck with everything we do, with every step we take, with whether we're standing. And that ankle, I have improved people's pain pretty much everywhere in their body by restoring ankle function. I'm talking elbow pain, neck pain, low back pain, knee pain, hip pain. The ankle is critical at restoring proper function. And most people have a history of injuring their ankle, whether it was sports in college or gymnastics, or they had some surgery or some issue that required them to be non-weight bearing for several weeks. The ankle is going to play a role. And it's actually fairly simple to restore the function. But if people don't know about it, it goes completely under the radar.
So unless you're working with a practitioner who's, who understands this, you might not end up getting that trickle down information.
Yes.
With women with autoimmune disease, a lot of times we deal with chronic fatigue, and we're talking that overwhelming sense of fatigue. And I know, speaking from my own experience, like I used to love to work out and be active. And my story started with, the physical symptoms started with mono, knocked me down hardcore. And for ages and ages, every time I would try to get back into a normal workout routine, or what I thought what used to be normal for me, I would be okay for a week or two, occasionally 3, and then it would all catch up to me and I'd be laid out again for another 3, 4 weeks. And it happened so many times that I got into this mental cycle of being afraid of stepping out and trying to do anything that would exert my energy or pick up my cardio rate at all. And I'm curious, because I'm sure you come across this with other people that you're working with, not that you're necessarily schooling them in a full-blown fitness routine, but you're working with them on their mobility. And I assume that you come across people that are dealing with the fear of trying to work through this.
Yes. Yes,
How do you work
absolutely.
with them?
Yeah, as a matter of fact,
both on a mindset and a physical level.
Yeah. So there's someone right now that I'm doing I have a pain program where people commit to 12 one-on-one sessions, and I'm working with someone right now who's dealing with some severe fatigue, AI issues. And when she first connected with me, she wasn't sure if anything I had to offer would help her, but she was willing to try because she'd kind of tried everything. Now I know we can say we tried everything, but there's a lot out there. So there really isn't anybody who's tried everything, because there's a lot of stuff out there that we don't even know about that happens and is available. So But the issue was, she did have a lot of fatigue challenges and a lot of pain challenges. And so we got her started very slowly, but it was very important for her to move. Very important because, motion is lotion. The joints need to move. There's a fluid that feeds the joints nutritionally. And if the joint doesn't move, the joint can literally starve for nutrition. And people may not be aware of this, but if somebody's in, say, an ICU and they're on a ventilator and they're not moving, someone has to go in and move their joints because after about 72 hours, those joints will start to break down. So and I'm not saying somebody who's actually living and moving and not bedbound isn't moving enough to replace that fluid, but the more we move, the healthier our joints are.
Hey, I just wanted to jump in here and interrupt the program for just a hot minute. You know that I'm so passionate about this podcast, but what I'm also really passionate about is helping women with lupus minimize their symptoms, boost their energy so that they can indulge in life again. So if you are a woman who is struggling with lupus, who is sick and tired of being sick and tired, who's struggling to manage your flares, if you're finding that your lupus symptoms are just really getting in the way of you being able to live your life the way you want to, I feel you. I've been there myself and I felt the same way. And what I've found is that there are a certain set of health fundamentals that once applied will support you in your foundational health. They will support you in building and maintaining that energy, minimizing flares, and allowing you to, again, indulge in life and follow your passions. So, if that is something that you are interested in creating for yourself, let's jump on a call together. I will walk you through the process that I use with my clients to get them from sick and tired to strong foundation of health by implementing my Health Bridge protocol. If this is something you're interested in chatting more about, I would love to talk to you. Apply for a free clarity call with me, and I look forward to getting to know you soon. And now back to the episode.
And so the goal wasn't to have her plan like she was going to run a marathon, but the goal was to get her to move her body in 3 planes of motion gently initially. And we did start with ankle function. And there's this 3-plane technique that I teach people how to mobilize the ankles and restore that function. And she was able to do those because those don't require the cardiac response. Those, it's not like high intensity interval training or anything like that. And over the course of not that long of a time, she did start to see some positive response to the movements and start to see some of those long-term chronic issues improve, which had been pretty debilitating and kept her from having pretty much any quality of life. And she, of course, was applying other strategies as well. She did have the nutrition component in place and she was hydrating well. She was, doing those things. But she did see improvement in the pain, which did reduce the fatigue to some level, because when you're in a lot of pain, your body is overworking just to move, just to like go from the living room to the bathroom. And it's going to require a lot more energy, a lot more calories to just move. And so pain is very fatiguing on top of a fatigue issue with AI. So she's had I don't want to use the word relapse, but she's had an issue where the fatigue has hit her again, kind of like a brick wall. But she's able to do the movements that we instructed her in so that she's not losing the gains she made as far as her ability to move and the pain. So that's been very helpful because it's not overly fatiguing to do these movements. And we're waiting for her body to start to rebound again, and then we can do some more progress.
I think that's huge. It's very common for us to go through these cycles when we have especially the chronic fatigue or any of the flare-ups that we experience. And there's mindset issues or mindset perspectives that we can address around that as well. If we can know that when those flare-ups happen, that it's actually, I see it more of as now, I should say. Now I see it as more of a healing phase It's more of your body trying to step up and elevate, even though it feels like the opposite and it feels like a setback. It's actually your body hitting a new normal. And it's like, wait, are we okay here? And then we have to respond with things that will keep our nervous system steady and stable and calm rather than allowing ourselves to freak out when we have that next flare. And it sounds like this particular person you're working with might have some solid support as far as addressing the mindset aspect of that, I hope. But I love that you are able to work these things in with her and show her that she can still do these simple things for herself to take care of herself, even when in the middle of a flare. And
Yes.
that
And that's
is
huge.
it's so
Yeah.
empowering. It's so
Yeah.
empowering.
Yeah.
Uh,
Yeah.
I see so often, and I've talked about this before with on my podcast with somebody that teaches yoga. There's so many people that I see that mock the, oh yeah, yoga's gonna fix my autoimmune disease, or doing these certain movements or exercises is gonna fix everything. It's like, well, no, it's not. But let's talk about the nuance here, right? Let's talk about how what you're doing is helping to stabilize and keep the body functioning so that it can reduce the pain a little bit, so that it can reduce the inflammation, so that we're not adding to the fight or flight. We're not saying any of this is a cure all. We're saying this could really help, but you have to go about it at the right way in the right pace. And for me, getting back into movement was committing to 10 minutes of yoga in the morning when I got up. Just 10 minutes. 10 minutes. That was it. Sometimes I could do more than that. Sometimes I barely got through the 10 minutes, but over time I got that in my routine. Now I don't barely go through a day ever without it. It's how I keep myself normal even when I'm not feeling great. And so I would just love to invite our listeners, if this is something that they're struggling with, that they can just keep an open mind about what movement might look like. Maybe their perception of what movement and fitness, I'll just say, has to look like. Maybe it can actually look a little different, a little softer, a little calmer, and we can really get somewhere with this.
Yes, absolutely. And, I love your perspective about the not freaking out about it, because even people who don't have AI, if they are in that run from the bear mode in their nervous system and they have this overload of sympathetic nervous system overdrive, it releases all these chemicals that are not your friend. And your muscles are going to stiffen, your joints are going to stiffen, your all of these things that happen, it's going to disrupt digestion. It's because we have an enteric nervous system, which is literally the brain that digests the food. And that doesn't function when you're in the run from the bear mode. It shuts it down. I teach breathing strategies to improve that vagal tone and to get people out of the run from the bear mode and into the heal and repair mode. Yes, I love your perspective about that getting into the heal and repair mode. That's huge, because running from the bear doesn't help. It hinders. It will obstruct any positive effect that you want to engage in. And I kind of call it the floor. What's your floor? What's the least amount of thing that you can do, that you will do, that you'll commit to do every single day? And I have people in my programs who they commit to doing like that 15-minute workout. Well, that might be too much for somebody who's really got it, especially a flare up. You can do 5 minutes. You can just do 3 repetitions of everything. And just getting that 3-plane motion, that fluid fill effect, that pumping action, just can really help for people to feel better. And even if you don't have AI, if you're not moving, you're going to have pain. Movement is required. The human body is designed to move. It doesn't do well when there's no movement. It just makes things worse.
So let's talk about lifestyle, because we've created this lifestyle and environment that's so normalized these days of sitting down indoors all day, working on our phones, working on our computer under fluorescent lights. We are sedentary. We're sitting in our cars when we're commuting. How much does that add to our pain and inflammation and the normalization of the idea that as we grow older, things just hurt?
Yeah. Yeah. Well, there's a couple of really big topics there. There's titles that say death by sitting or the desk sentence. And yes, when we are sitting all the time, it wreaks havoc on our body's physical ability to be upright. And the quickest way to explain it is you're sitting on your power source, which is gluteus maximus. I call him Max. So when you sit on Max for hours, months, years, Max shrinks, he atrophies, he loses strength, and he's the power source. It's the largest, most powerful muscle in the body. At least that's what it's intended to be. And so when you go to push open a heavy door, you're pushing into the floor using the power of Max. It's not even your arm strength that you're counting on as much as you're counting on Max. When you go to sit down or stand up, you're using Max. When you go to get in and out of a car, we're using Max. He's got to work. And if we're sitting on him, he's not working all that great. And so that's important. And then the front of the hips, if you're sitting, those hip joints, those hip muscles shrink, or I should say shorten. They kind of get locked short. And so then when you go to stand up, you might feel back pain, low back pain, and you think, oh, I've got a back problem. No, it's a front hip problem because those muscles attach to the lower spine. And when you go to stand up, you're asking those muscles to get longer, and they've been shortened for like 8 hours or however long you've been sitting. And now they kind of yank on the low back when you're asking them to get longer. So there's so much that sitting will do to us that is not our friend. And I tell people this is a really simple strategy, Holly. Even if you've got AI, even if you've got a flare up, no matter what's going on, because this requires such a minimal amount of effort. It doesn't drain energy or require a lot of calories. It's a simple thing. Just set your phone to go off about every half hour. And all you need to do is stand up and just very gently shift your hips forward, just gently. You're not trying to yank on the low back. You're not trying to, join a circus and bend backward. You're just doing this gentle hip action going forward and back. And if you feel some pain from that, minimize how much you're going forward and try going back a little bit more and then come forward. So you go back, you're kind of shortening those muscles and making them feel a little more secure and less threatened. And then as you come forward gently, they'll be more likely to cooperate with you. So just doing that, you can just do that 10 times. It literally takes just a few seconds. And then you can do, if you're okay with it and it doesn't aggravate your knees, you can do what I call chair squats, where your bottom goes back like you're going to sit down. And you go as low as you can go comfortably and just do a few of those. The whole thing takes, I timed it once, it was like 20 seconds. Doing that every half hour, it doesn't drain you, doesn't require a lot of energy. You're not going to get sweating or huffing and puffing, but you're going to feel better by the end of the day than if you just sit and you don't get up.
Yeah, I find at work when I am sitting all the time, I really, really have to make an effort, like a conscious effort to do something similar like that. Get up out of the chair, stretch my hip flexors a little bit, walk the length down to the bathroom and back, like little things like that. Otherwise, I hurt. I hurt.
Yes.
I mean, I've had jobs where I was on my feet my whole life, and now I'm working from home, doing podcasts and coaching. And during the day at work, I'm sitting at the front desk, and my body is like, what are you doing?
And I do a lot of research. I mean, I'll have 12 windows open. I'm looking into all the data and the biostatistics and all this stuff and creating content and all that. So I do a lot of sitting, but I have to force myself to get up as well. And I did buy a desk that goes up and down, which was a really minimal investment. It was like, I don't know, $130. And it goes up and down really easy. I just push a little lever. And so if I'm sick of sitting, I got to get up. I just get up. Like right now I'm standing, but I can sit when I'm tired of standing. And I just wanted to caution anybody out there who might be considering, getting a standing desk or standing more. Just standing still can cause its own problems. because the body's designed for movement. So I tell people, if you've got a job or something that requires you to be on your feet, like a cashier or whatever, try to stand in a little bit of a stride position with one foot forward slightly and do a little gentle rocking back and forth, sort of this diagonal movement. And you can do it, both sides, switch your foot position, and that can make a big difference throughout your day so that you're not getting that fatigue from that constant standing.
Those are really great tips. I'd love to, because we've touched a little bit on nutrition and what role that can also play in how inflamed and how painful we're feeling in our joints. And I'd love your perspective on nutrition and how you counsel your clients.
Mm. Well, I do have a diploma in nutrition education, and it was a 900-hour program from an institute that was not industry funded. So it was very data supported. And so I have understood the relationship between how food can create intestinal permeability or leaky gut. And so food isn't supposed to enter the bloodstream, but if you've got some leaks going on in your digestive tract, little particles can end up in there, which triggers the immune response because it's like, oh my gosh, that's not supposed to be there. It's a red alert. And then there's this mimicry of the cells where the immune system says, did we miss anything when it goes after this stuff circulating? And it may come across a body part or certain organs where it says, oh, that looks like the invader and I missed some, and it starts to attack you. So that's a lot of what I've learned about what can trigger AI. And I can tell a couple of stories if that's okay.
I would love that.
One of them is my daughter, who was diagnosed with RA. Now she is a marathon runner, very gifted, does really well, gets sponsored. And she lives 2,500 miles away from me. So I would, she would talk with me and say, oh, Mom, I've got this symptom, I've got that symptom. And of course, because of all the marathon training, it's common to have symptoms.
Really quick, Holly B here. I just wanted to interrupt the podcast to ask you for a quick favor. Can you take just a moment to like and subscribe to this podcast on whatever platform you are listening in on? It makes a world of a difference. And the reach of this podcast, it takes like literally under 10 seconds. So go do that right now. Thank you so much. I really appreciate it. And now back to the episode.
And so I would give her some advice, and she found a local clinician that she could go to get the manual work if that was required, and it would be helpful. And she never shared with me just how severe her symptoms were. And then one day she decided to sort of confess that she had joint pain so bad that sometimes, like an ankle pain, that her husband would have to carry her up the stairs to the bedroom. And she would have wrist pain so bad that her sons would have to open a door for her. And I immediately said, oh my gosh, you have to eliminate the dairy, because that is one of the offending foods that I have been taught can really trigger. And I've worked with many people over many, many years and have seen this to be true. I've observed this. And so I told her, you've got to get off the dairy, that, your body is responding. And so she did, and she immediately saw improvement. But because she had been experiencing these symptoms for a couple of years at this point, it had really kind of taken hold. And so it wasn't easy to reverse at this point. And so, we did a lot of back and forth. And eventually I recommended that she go to True North, which is the only very well medically supervised fasting facility in the country. They're in California, actually. And they have a stellar record of no adverse events or problems with people because they really know what they're doing. So you're not at risk. Now, she was a marathon runner, so she was like 102 pounds soaking wet when she went. So to fast, when that's all you weigh and you really have no body fat, you don't have much weight to lose. So they're monitoring her very well. I will never forget, I was doing some lectures for kind of a forward-thinking insurance company in East Lucans at the time, and I was in Kentucky, Illinois, those different places. And I was going to be the first speaker going on at 9 a.m., and my phone rang at 8:30. And I went out into the hall because it was my daughter, and I knew she was at True North, and she's crying. And she says, and I'm like, what's wrong? What's wrong? I mean, I was panicked. And she said, this is the first time my feet hit the floor in 2 years that I didn't have pain. And I still get chills when I share that, because that she was sobbing because it was the first time she didn't have pain in 2 years when she got out of bed. And her next thing was, it's the food, because she hadn't been eating. So now your body does do a lot of reset. There's a lot of great research and clinical studies that have been done on all the things that goes on with the body when you fast. You do need to be medically supervised, especially if you're on medications, because it completely alters how those respond in the body. So I'm not telling anybody here to stop eating. So I don't want anybody to hear that. But she was very well cared for. After losing a certain amount of weight, they were monitoring her. She had special, like a celery juice a couple of times because of her electrolytes and things like that. They really watched her carefully. But the issue was refeeding. Once you start eating again, you've got to figure out what foods might trigger your symptoms. And so when she got back home, she's a busy mom. She's got 3 boys. She's very involved in her life. And how does she navigate this special way to eat and figuring out what she can eat and what she can't eat? So there was a lot of roller coaster for a couple of years after that. And she would have flare-ups, and she got very, I don't want to say hopeless, but she despaired, like, what's going on? And I explained to her, and I love how you made that connection earlier about when you feel like it's a flare-up, it's actually your body moving into a better way. It's your immune system kind of is working more. And so she was trying to figure out, I'm not even stressed right now. Why is this happening? And I said, because your body's in a calm state, it can start to fight things. So you're going to get this response. When you're extremely stressed, your immune system gets suppressed. So it's not working so well. So you're going to have less symptoms. So, and everybody's unique. Everybody's different. So fast forward, after a lot of challenges, a lot of up and down roller coaster rides, she came to visit me, and she was taking an NSAID, a non-steroidal anti-inflammatory for joint pain, because she was Rananol. She was pain-free at this point. She had really come a long way at this point, but she was living on these NSAIDs, and it completely trashed her GI tract. I mean, her stomach was a mess when she came to visit me. So we did a lot of things to turn that around. And she realized when she stopped taking the NSAIDs, she still didn't have pain. So she was thinking that's what was eliminating the little bit of pain she had left, but she didn't need it anymore. So that was interesting observation for her to make. But I think it was roughly 6 or 7 years after her initial diagnosis. She went to the doctor, had blood work, and she was completely free of RA. She had a normal SED rate. She had no her factors, everything was normal. The doctor told her, you do not have RA. You are medically free of RA. So now, thankfully, she never was on any of the medications that have some pretty horrific side effects that people feel like they kind of have to go on. She does have a little bit of limitation in her wrists. That's the area where she's lost a little range, but that's pretty much it. And she's, back to running and doing all kinds of things again, and she's heading toward 50. So she's feeling pretty good. But, we also did a lot of prayer. I'm not going to negate that. I think that may have had a lot to do with it too. She had a lot of support at her church and that kind of thing, because we are multifactorial beings. We're not just a physical body. But that was huge for her. Now, the other story, which is going to be much quicker, my husband, he had been taking those enzymes for someone who can't digest dairy, because dairy was a big problem for him, and he would have some pretty serious results whenever he ingested dairy, and he didn't want to give up his pizza and his ice cream and all that stuff. So he started taking the Lactaid tablets so that he could have his food. And he did that for a couple of years. Unfortunately, I believe that created a leaky gut for him as well, because he started having some serious joint pain issues. And he told me, and I said, it's the dairy. He said, no, it's not, because I don't have the pain all the time. And, I go days without the pain and all of this. And so I said, okay, don't listen. So he had joint pain again, so bad that he could barely climb the stairs. His knee just swelled up, and he had joint pain where he could barely chew. It would move all over his body. And so finally he decided, okay, I'll go without the dairy. We'll see what happens. He went without the dairy. And he goes, because I had times where I had no symptoms. How do I know it's because I went without the dairy? So he consumed some. And he had so much pain, so much joint issues that he could barely function. He couldn't even go to work. And so he's like, it's the dairy. But here's the cool thing. Now, I'm not saying that you necessarily have to give it up for the rest of your life, but after a few years of him, we had to be really careful. You can even buy whole grain pasta that has dried milk in it. You got to really watch the labels because it can trigger. If you've got an AI issue and you've got any kind of leaky gut, just the tiniest amount could really trigger things. And so, he'd have these flare ups and we'd realize it was in something that he didn't expect it to be in. But after a few years, he could get away with a little bit of dairy. Like now, he can get away with a little bit of dairy and it doesn't trigger anything because his gut is healed. But he doesn't take too much of a chance. He's not trying to bring that back. And he also has, he's Greek. So he's got that Mediterranean background. And a lot of times, specific ethnicities can have more issues with things than others. But that's just to let people know that, what you put in your mouth can make a huge difference. And it's worth trying because there's no potential harm in eliminating a certain food for a few days or a week or a couple of weeks. And there's only potential benefit. So why not give it a shot?
I see so many women who struggle with their autoimmune disease. They're posting online, they have their other diseases listed out in their Instagram bio. And when I scroll through their feed, I'm seeing like, oh, feeling funky. So I treated myself today to, a Starbucks latte and a big muffin or a cookie or, some kind of dessert. And I just want to say I get it. I totally get it. When you are feeling like crap, you just want something that's going to make you feel good. And your taste buds, when they touch sugar, it
Yeah, that dopamine.
it's
Yeah, makes you feel
dopamine.
better.
It feels like love, right?
Yes.
It feels like somebody's hugging you. So
Mhm.
I get it, and I give into it too. But I've been through the ringer so many times that I know that I intentionally have limits. I intentionally have boundaries. The holidays, I'll indulge, but I get back to my normal. I don't let it continue. And I think that I hope that this conversation again has just opened some of our listeners' minds to maybe I should just start paying a little bit more attention. Maybe I could cut out dairy for 2 weeks and then add it back in and just see if I notice a difference, or
Mhm.
gluten or sugar or soy. There's a few heavy hitters there, eggs. I hope that we can help women realize that there is so much that is under our control.
Yes, absolutely. And to speak on the gluten, yes, it is a common trigger. And my daughter, who I spoke of, it was more like dose dependent of gluten. She didn't have to be completely gluten free, but she noticed if she intook more than a certain amount, like if she had it more than once in a day, it would flare up her symptoms. So she could get away with a little, but not a lot. So everybody is unique. It doesn't mean you've got to live on, lettuce the rest of your life. I mean, there are options, and there are a lot of foods out there that are known to be relatively safe and not trigger things. So, but learning those differences can make the difference between having a good day and having like the worst day of your life. So,
Yeah. I'm similar with gluten. I mean, I stay away from it almost completely. But if there's some cross contamination, that doesn't seem to trigger anything. But I did have an incident, and I do it in small doses, but I can occasionally do a long fermented true sourdough.
okay.
Maybe a slice, but I don't want to
Mhm.
push it beyond that. I had an incident about a year ago where I went to a bakery that does a lot of long fermented. And so many people that are sensitive to gluten can do their stuff without issues. And of course, she cautioned me, said it's not a gluten-free kitchen, but this is how we do it. And she pointed out to me the things that were the long fermented. I've had some bread from them before without an issue, but this one time I tried something different, and whatever it was, she may or may not have told me wrong. Maybe it wasn't the long fermented. I don't know. Maybe it just who knows? I reacted quickly, and it took 2 months to get it out of my system. So from
Mm.
there on out, I've been back to fully cautious.
Yes, yes. And there are those who need to be medically free of
Yes.
gluten, like they can't have it in their house. My closest friend, ulcerative colitis, who, and Crohn's, those kind of things. I mean, just her daughter would make a pie for Thanksgiving in the kitchen, and just from the flour molecules floating in the air, she would end up with bloody diarrhea. It just, yeah. So some people, they can't have it anywhere near them. And unfortunately, there's a lot of things that have gluten. I mean, even gum, lipstick. I mean, it's everywhere. So
Shampoo, lotion. Yeah, I know. So I guess all of this being said, to bring this all kind of together for someone who is open to making some lifestyle shifts, but they're overwhelmed, they're not feeling good, they're in pain, where would you suggest that they start?
mm. I think the biggest thing is the mindset. First, realizing that you may be able to have more control over your situation than you were led to believe by people who might not have the knowledge that could really help them. So I think that's the first thing, just realizing that, oh, I might have some control over this. That can help, because feeling out of control is really a helpless thing. And I think the next thing is not feeling like you've got to do everything perfect and you've got to get it all right, because that's extremely stressful. I've been consulting with people now for a very long time, and I've met many people who they're so concerned about doing everything perfect and everything right. They are in such a run from the bear mode, they can't calm down. And that's just increasing their pain and their symptoms and stressing out their life. So just taking a deep breath and just saying, okay, what can I do today that might be good for me that I didn't do yesterday? Just something simple like that. And I teach people, that maybe just getting up every half hour or hour at the most and doing those little hip forward things. That might be enough for today to make you feel better. And then tomorrow you feel like when you get up, you feel a little bit better. So you might be up for doing a little bit more of something. So just start somewhere. If you're not well hydrated, just start with drinking more water. And obviously make sure it's healthy, filtered water. Just start somewhere. And it doesn't have to be perfect.
Baby steps and consistency.
Yes.
Just to add to what you were saying, perfection is like the killer of progress, and is also, I would see it even as a potential root cause of autoimmune disease.
Yeah. Yeah. Because of how it triggers the body. I remember someone who wrote, perfectionism is like the terrorist that holds us hostage
Yes.
to making changes.
Yes.
Yeah.
So yeah, you're so in line with everything I believe. One step at a time. We have the power to make changes in our situation, and just picking one thing to start with, like drinking water. Just drink one more glass of water today.
Mm-hmm.
Start there.
Yeah. And, to follow up on that, the medical profession is their prognosis. Maybe some of the reasons that so many people feel hopeless, because they're told there's nothing that can be done. This is the best we can do. They can be wrong a lot. It's called a medical opinion for a reason. And you can go to 3 experts and get 3 completely different opinions. So I would challenge everybody here, prove them wrong. Try some things, see the differences, and you may just be very happy you did it.
Yeah. Or you could even say prove them right. Right? You could even say prove them right. In other words, okay, I'm going to prove that they're right. I'm going to make these changes. I'm going to shift my nutrition and show myself that they're right. Show myself that I should still be able to eat cake or whatever I want to eat, and it's not going to make a difference.
Yes, I love that, Holly. I didn't even
Right?
think of that. I love it. That's the flip side of the coin. Yes.
Exactly.
Mhm.
Eileen, where can everyone find you?
Well, probably the best place to find me is, I have a lot of websites, I have 2 for my books and all kinds of things. So to make things simple, my main website, it's a kind of a long handle, havelifelongwellbeing.com. And there is a 5-question quiz that they can answer, very simple questions, takes less than 2 minutes. And it will aim them at the resources and the content and whatever I have, whether it's on YouTube or wherever, that will answer their concerns or show them what I have to offer based on what they're there for. So
Thank you so much. Yeah, I think what you do is so valuable, and obviously you're changing lives. So I hope that everybody reaches out to you, takes your quiz, and gets some really helpful resources from you. Thanks so much
I
for
hope
being
just
here.
the few things I shared today were helpful. Just moving. Yes.
Absolutely. Thank you so much.
Thank you, Holly.
Thank you so much to Eileen Kopsaftis for sharing her expertise today. I hope you're walking away with a new perspective on pain, aging, and what your body is truly capable of, plus some practical ways to move safely and reduce inflammation and rebuild strength without fear. If this episode spoke to you, please remember you don't have to navigate autoimmunity alone. I'd love to support you on your journey. You can find my free daily lupus guide and symptom tracker in the show notes. It works just as well with any other autoimmune condition. Or you can also apply for a free health breakthrough call if you are ready to go deeper. Until next time, take a deep breath, give yourself some grace, and keep building your bridge back to health.